Lifestyle medicine for COVID-19 and NCD care, a wake-up call. This event is proudly supported by the Lifestyle Medicine Global Alliance, the American College of Lifestyle Medicine, the International Board of Lifestyle Medicine, the Department of Health, and the Philippine Medical Association. The Philippine College of Lifestyle Medicine is also supported by several institutions pioneering lifestyle medicine practice in the country. The Remnant Institute Incorporated, a center for lifestyle medicine and education. The Adventist Medical Center, the Four Leaf Lifestyle Medical Group Corporation, the Plated Prescriptions, and the Culinary MD. This event is also made possible through the help of our sponsors, the Pascual Pharma Corporation, the Omron, the Taisho Pharmaceutical. Simply
When accuracy becomes embedded in technology, when medical becomes personal, when life presents zero compromises, that's the sign of the future of healthcare, a future with Omron. Omron is devoted in creating innovative products and services for the benefit of everyone's health, opening possibilities in health management that can be integrated in everyday life. For decades, Omron has made blood pressure measurement at home accessible, designing each device with unique vital sensing technology and rich clinical data to provide the best quality on a global basis. Omron's range of products help people lead healthy and secure lives, conveniently sized, precisely fit, and accurately detecting, whether you're at home or out and about. Omron's state-of-the-art products makes health management easy. They allow people to live a life of zero events, a life with reduced incidence of diseases caused by high blood pressure. Omron has led the advancement of blood pressure monitoring, penetrating the global market as a competitive brand that assures quality and accuracy. Though it took more than 35 years before the first 100 million units of Omron blood pressure monitors to be sold worldwide, 200 million units were sold by 2016, showing how Omron Healthcare have been rapidly penetrating the global market. Compelled to forge a healthy future for individuals, Omron's monitoring devices are easy to use yet medically accurate, which is why Omron's monitoring devices are likely recommended by doctors here in the Philippines and in various regions. Omron knows the importance of detecting hypertension in its earliest. That is why Omron's blood pressure monitors for home use are designed with innovative features from precise feed cuffs, advanced accuracy technology, to Bluetooth data accumulation. Everybody can monitor their heart health efficiently and know when to be aided medically. Accessibility, quality, accuracy. These are the qualities why Omron's blood pressure monitors are validated by the Philippine Society for Hypertension, showing outstanding results for both past and present models. Omron is available within reach, so everybody can take charge of monitoring their heart health. Everyone can now look forward to a future of personal health management, a future when medical technology has reliable accuracy, a future when medical assistance is just a tap away, a future when life has zero events, zero compromises. This is the Omron future. This is Omron Healthcare.
Dr. Nicole and Buenavista is a certified lifestyle medicine physician, an occupational physician, and a health and wellness speaker. She is a diplomate of the International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine. She is a member of the Philippine Digital Medicine Society and the co-founder of Four Leaf Lifestyle Medical Group. Dr. Buenavista obtained her medical degree from St. Louis University, International School of Medicine. She attended observership programs on internal medicine and geriatric medicine at Piedmont Henry Hospital and other institutions in Georgia, USA. She attended Harvard Medical School in Massachusetts, USA for lifestyle medicine and culinary medicine. Dr. Buenavista also took online courses on positive psychology and mental health during COVID-19 under the University of North Carolina and the University of Toronto respectively. She was exposed to different types of chronic diseases as she transiently trained as an emergency medicine physician at the Makati Medical Center. In addition, she obtained her basic course in occupational medicine certification at St. Luke's Medical Center under the Philippine College of Occupational Medicine. Dr. Buenavista served as a medical director for a health tech company with blockchain-powered applications including electronic medical records, telemedicine, and medical applications. Now, she currently works as a medical consultant on corporate wellness programs for different companies in Metro Manila. Today, she will talk about lifestyle medicine group practice, patient-centered collaborative approach. Please welcome Dr. Nicole and Buenavista.
A healthy day to everybody. I'll be discussing lifestyle medicine group practice, patient-centered collaborative approach. Thank you so much, Philippine College of Lifestyle Medicine, for having me as one of your speakers for this annual conference. I am Dr. Nicole Ann Aika Buenavista, a certified lifestyle medicine physician, a diplomate of the International Board of Lifestyle Medicine, a member of PCLM, and an occupational health physician. I have no financial disclosure or conflict of interest with the material in this presentation. So our agenda for today is to talk about group practice, the features and importance. We'll be discussing team roles and creating a referral system, a network of healthcare professionals and services. We'll be tackling key strategies for leveraging an interdisciplinary team, which will include group visits. We'll be discussing 10 characteristics of effective interdisciplinary teams, as well as the outcomes of creating this interdisciplinary team care for patients. And of course, we'll be tackling the benefits of creating a group practice. So as physicians, we make the decision on how we would like to practice our profession, okay? And first, we have different types of practices, and one would include the group practice. So what is a group practice? It is where it involves two or more physicians who would all provide medical care within the same facility. They utilize the same personnel and divide the income in a manner previously agreed upon by the group. So there is an official agreement. Group practices may consist of providers from a single specialty. For example, all of you are lifestyle medicine practitioners, or multiple specialties. So for example, you can have other subspecialty doctors like cardiologists, endocrinologists, OB-GYNs in your group. So before, group practice is only limited to one geographical location, okay, working in the same facility. But with the advent of the new normal, okay, this pandemic, it has shifted the group practice to a more virtual type of practice. So even if your group members would be in different geographical locations, that would be fine because we can now do our consults online. So this is the new normal, the new era of medicine where we're using technology to our advantage. Right now, there is no limit to group practice, so it can be done virtually or it can be done in person. And of course, the goal of creating a group practice is patient care to optimize the management and treatment. Okay, so more heads are better than one. So if we can get the opinion of other doctors or other specialties, other fields, of course, for the best care and management for the patient. So what are the qualities of creating a group practice? Okay, what does your members have to have? So first, commitment. Okay, that's one of the basics. Everybody has to be committed to the group practice, who will be there not just at the start, but until the end, and of course, during the difficult times. I'm telling you, it's not easy to create and start a group practice. Second is understanding. You have to be in the same page, okay? You have to have a clear vision and mission. So you have to create that first before proceeding with the other steps. And third, very important, is respect. Respect for each other's time, each other's roles, each other's fields in medicine, each other's knowledge. Okay, so important that there is always respect, and then that everybody has the equal, okay, right to make decisions in the group. So next is assigning roles. So as a startup, you can assign to each other the administrative tier as well as the medical tier. So for the admin, you can assign, of course, one of your members to be the president, the one who will lead the group. You can assign the others to be the financial officer, the marketing officer, the one that will be handling corporate accounts. Okay, so you have to assign first to yourselves. And of course, the medical tier, which would include, you can do this by subspecializing. So if everybody are lifestyle medicine physicians, you can assign one who will be concentrating on cancer prevention, the other one will be concentrating on obesity management, the other one on cardiovascular diseases. So your group members can concentrate on one field alone, and you can refer to each other. So important to assign the roles, again, the admin tier and medical tier. Next thing that you do have to do is to create roles for your staff. Okay, so you can hire your admin staff as well as your medical staff. So first, other the admin, you need a admin assistant who will be in charge of scheduling, follow-up, referrals, coordination of materials in the program that we'll be creating. Another is our marketing director who will be in charge of communication with providers and resources in the community. Next, you have your medical staff. Okay, that would include a nurse, a registered nurse, will be in charge of the education of your patients, biometrics, assessment, and continuity of care, as well as follow-up, especially for those with chronic conditions. Another is a exercise physiologist who will be in charge of the PARQ assessment. That's important for physical activity, individual and group exercise supervision, even though this is done virtually, biometric assessment, fitness, safety, and principles presentation. Another, we can hire a health coach who will be in charge of the mechanism for implementation, consistent sources of social support throughout the change, and as well as built-in accountability. Because remember, in lifestyle medicine, we are dealing with behavior, and it's something that is really hard and will take a long time to change. So a health coach can help with that. Another is to hire a stress management specialist who will be in charge of introducing various mind-body techniques, group facilitation and support, participation with individual and group fitness instruction, okay? Because it's really stressful to go through a lifestyle change. Another is a registered dietitian, very important. As one of the cores of lifestyle medicine is nutrition. So the registered dietitian will be in charge on one-on-one nutrition counseling, group presentation on nutrition guidelines, recipe referral as well. You can also get a chef or food services so that you won't have to worry about preparing the food. So they'll be in charge of training in food selection as well as preparation and remove barriers of healthy eating. Okay, so we have some of those services already in our locality in the Philippines. And of course, you can hire a group support specialist who will be in charge of facilitating social dynamic and group growth that would focus on lifestyle impact of intervention. So very important to create a peer-to-peer support. Okay, so these are some of the roles and the staff you can hire to help with your group practice. Next is creating a referral system. So of course, we do have limitations to our own field of practices. So if you need the opinion of other subspecialty medicine that you know would be the best for the patient, then refer, okay? Do not hesitate. And since lifestyle medicine is new in the Philippines, okay, we have to create awareness, introduce yourself to the other subspecialties, to the other fields of medicine, to other healthcare professionals, and create a friendly and harmonious referral system, okay? So do not overstep, just show them that you can help them with regards to the treatment and management and what you can do, and make sure that you show them that you are vital, okay, in the intervention and management of the patient. So very important to refer because especially for subspecialty practices like cardiology, OB, endocrinology, those who are diabetologists, they would need to be there with regards with the treatment, medications, with dosing, as well as monitoring the laboratories and follow-ups. Okay, so creating a harmonious referral system. And so with this referral system, we can create a network of healthcare professionals and services. So reach out first to professionals in the local network to discuss how to mutually support each other's work with an emphasis on the lifestyle medicine approach. Okay, so again, you have to be on the same page. You want to prioritize working with your co-lifestyle medicine specialist and lifestyle coaches to assist with the lifestyle behavior changes and treatments that your patients are undergoing. So you also want to collaborate with lifestyle medicine physicians who are conducting intensive therapeutic lifestyle therapy changes, what we call ITLC programs, like the Complete Health Improvement Program. You can also reach out to dietitians, very important. Their role is very vital with lifestyle change, especially for nutrition. You want to reach out to health educators, certified exercise physiologists for those who would want to incorporate more physical activity and exercises, as well as the fitness trainers, coaches, and psychologists. Okay, so very important mental health. We need this throughout any lifestyle change. Also in this network, you can collaborate with integrative medicine practitioners who are already including some aspects of lifestyle medicine in their practice already. So many integrative medicine providers are already discussing lifestyle medicine changes with their patients. And if you are referring patients to them, check to make sure that the integrative medicine practices are aligned with lifestyle medicine, of course. Okay, so don't forget the principles of lifestyle medicine. So you can collaborate with acupuncture, oriental medicine, chiropractic, midwifery, massage therapy, and naturopathic medicine. So they're already incorporating lifestyle medicine in their practices. But again, note to when to draw the line. Okay, make sure that it is still in line with the lifestyle medicine principles. So what are the key strategies to leveraging an interdisciplinary team? So first, you have to train the support staff who will be in charge of routinely collecting lifestyle medicine vital signs, which will include exercise, nutrition, waist circumference, and physical activity. You would want them to provide basic counseling and instruction, the importance of various lifestyle factors. They would also be in charge of providing tools and resources, such as handouts, community resources, websites, and apps. And of course, help patients identify community resources, where they are and what they provide. So one of the first questions patients would ask when doing a lifestyle change in terms of nutrition is where to buy the fruits and veggies that are safe, of course also affordable, as well as the food, okay, who are creating some whole food like plant-based food nutrition for them. So you have to give them the resources. Next is to use a team-based approach. Okay, so it's a team. Team is not only composed of one person, it has to be everybody. So you have to work together hand in hand. So you have to set specific standards and rules for all team members from the time that the patient will check in, from inquiries, up to the time that the patient will check out and to follow up. Okay, so you need an admin or front office staff who will be in charge of check-in. You want to ask the nursing staff to do the lifestyle vital signs, as well as do the pre-visit assessments, okay? And of course, the physician will be in charge of the clinical encounter, as well as counseling. So as soon as the patient will check out, you wanna have the admin and front staff do that. And you wanna ask the nursing staff to do the referrals or follow-ups, okay? So that is a team-based approach. And of course, third, you wanna hold regular meetings and use effective communication, okay? So to make sure that everybody is in line with the agenda, if there are any problems, you have to communicate this so that they can be solved immediately. Okay, so these are the key strategies to leveraging an interdisciplinary team. So one of the things you can do in your group practice is what we call group visits. So this is a team approach to monitor and treat medical conditions. So with group visits, it can provide supportive group setting for consenting patients with similar concerns. So for example, they all have diabetes. It will focus on chronic disease and can be an important tool in chronic disease populations management for primary care practice and for a community. It will require 2 or 4 healthcare professionals, including the provider or physician. And personal care can also still be given, as each patient's unique needs can be addressed individually while still maintaining privacy. So of course, all our patients have their own unique needs. They can still be addressed after the group visit. What is the value of group visits? So first, it will improve access to care. It will reduce waiting times for appointments, especially for those who are new patients. So we all know that it takes more time to consult new patients. Physicians can also accommodate more patients. Physicians can appropriately see more patients more frequently and for a longer time period, okay, to follow up on chronic disease management. It is also one means of reaching out to underserved patients. Another is that it will increase patient and provider satisfaction. So first, for the physician, of course, the benefits for the physician is more efficient use of time, allowing more time to check patients' test results, consultation reports by leveraging existing resources, return patient phone calls and emails so we don't miss out on anyone, spend more time practicing proactive lifestyle and preventive medicine, manage and lead clinical teams, collaborate with other colleagues, and coordinate patients' care across a complex care system. It can also enhance quality outcomes in patient health experiences while containing costs and increasing income. Sometimes it can be a good thing because it's different, interesting, and fun. Okay, it's not the usual consultation that we do. It reduces repetition and allows for more frequent contact and longer amounts of time with patient. Documentation support can be provided by another staff member, and group support and collaborative care is helpful in managing difficult, time-consuming, and psychologically needy patients. So we do deal with some patients who require more attention, so this will help with that as well. For the patient, okay, it can improve their adherence to standards of care, improve patient satisfaction, lower hospitalization rates, higher trust in providers, and improve access, receive greater patient education from group discussions and peer support, okay, so they can learn from each other. So sometimes one would ask a question that you wouldn't even think of, but the answer to that is something that can apply to you. Experience improve access to the professional skills of a behaviorist, psychologist, or nurse, which better addresses psychosocial needs. So what's good about this is that you learn from your peers. Okay, so if you have a psychologist on board, you have a diabetologist on board, okay, you can learn from each other because you are experts in your own fields. It's not just the patient who is learning, but also you as a provider. The patient can gain additional choices in their healthcare treatment options and use peer support. So very important is social support when going through a lifestyle change, okay? And how is this operated? Group visits can be heterogeneous with varying ages. So they can be of varying genders and medical conditions. So some of them can have hypertension, the others would have diabetes or heart disease. Or you can have a homogeneous group with similar demographics and medical conditions. So for example, all of them have diabetes And the majority of visits are pre-scheduled, of course, for this shared medical appointment or group visits. Patients will have to sign a confidentiality release, consenting to that they would allow their medical information discussed in front of others, and also agree not to discuss the personal information of other people when outside the group visit. Okay, so all the information will stay inside the room or the virtual room. Physicians will manage, advise, and treat each patient individually and accordingly. And of course, education is part of each visit. So awareness is key, knowledge is power. It always starts with education. And again, this group visits can be done virtually. So because of the pandemic, if we can't do it face-to-face, you can have a virtual group visits and the impact is almost as the same. So next, what are effective interdisciplinary teams' 10 characteristics? So you want to have these 10 characteristics in your group. So first is positive leadership and management attributes. So you need to assign one person who will lead the group to have a direction, a path, okay? Next is communication strategies and structures, okay? So create ways on how to communicate regularly. We have different apps again for that. So you have Slack, you have Viber, or any messenger to make sure that everybody is informed and updated with all the important decisions of the group. Personal rewards, training and development. So for your staff, it's not just the work, but also creating an opportunity for them, a career path. So you can train them, develop them under lifestyle medicine. You can also give them awards or rewards rather as incentives to keep them motivated. Appropriate skill mix, okay? So if a lot of you have different fields in medicine specialization, it's gonna be a good way to learn from each other as well and to give an opinion regarding the management of the patient. You also want to create a supportive team climate. Okay, very important, a positive environment, positive dynamic and relationships with one another so you can work properly for the best care of the patient, of course. Individual characteristics that support interdisciplinary teamwork. So everybody has to be a team player, okay? So everybody has to contribute as well, support the decisions of each member. Clarity of vision, again, going back to your mission vision, you have to be on the same page. Quality and outcomes of care. So your focus has to be on the outcome, okay, of your care, your management of your programs, how you can improve on them, and respecting and understanding everybody's roles. Okay, so respecting the roles of those who are leading the group, as well as understanding anybody's circumstances, as well as respecting the time that everybody has to give, okay, for the group to work and of course for the patient. What are the outcomes of interdisciplinary team care for patients? So first, we all have to advocate for lifestyle modification as a primary modality for chronic disease, okay? So it has to be a priority, creating these lifestyle changes for the patient. Supporting higher levels of self-efficacy and self-management in patients, attaining higher levels of treatment compliance with improved health outcomes. So the patient has to be compliant, they have to have the active role in their treatment, not the passive role. Only doctors are there to support them, to guide them, to give them the information and education. Implementing office workflows to effectively identify and address patient needs for therapeutic lifestyle change. So you would have to learn how to identify patients who have to go to a more intensive program, okay, to enroll them in those intensive programs. Optimizing patient time for support and offering counseling if applicable. So very important in lifestyle changes. So it would be beneficial if the group has a psychologist on board. Using electronic medical records, EMRs, websites, mobile apps that track lifestyle change progress and that prompt lifestyle interventions. So very important to use an EMR for the group where everybody can see the important details if you do want to refer a patient to one another. This is one way of organizing the records, very helpful, especially during this pandemic, this new normal, where everything is virtual. You can also use some websites, mobile apps to help your patients, like for example, MyFitnessPal that can help with nutrition-wise, or other gadgets like a pedometer that can help count the number of steps that your patients would do each day. So these are very effective. Using patient registries to identify patients who are in need of intensive lifestyle interventions and referring them if needed. Okay, so somebody has to be in charge of checking all the patients, their progress, and if they need to be enrolled in any intensive intervention programs. Implementing group visits to provide therapeutic lifestyle change treatments. So patients can actually be more successful if they're placed in a group type of situation or group visits because there's peer-to-peer support, so there's higher success rate. What is the benefits of doing a group practice? So first, for the patient, it will include higher levels of treatment compliance. Okay, so giving the patient the active role in their treatment, improve health outcomes, and enhance the patient's engagement and chronic disease self-management. Okay, so especially putting them in a group visit, it will help increase their confidence. Okay, they get inspired and motivated by their peers. So there is higher success rate. Now the benefits for a doctor for doing a group visit, of course, first it will increase financial security, better control of health and lifestyle. So don't forget, doctors have their own health. So this is one way for them to also walk the talk. So as lifestyle medicine physicians, we have to advocate for our own specialty. We also have our own mental health or physical health that we need to take care of. Provide more employee benefits. So it's one way of giving more benefits to your staff, your employees, your nurses, your nutritionists. Have the resources to manage the admin task associated with running a practice, relieving the individual provider from the need to do this alone. So it's better to do it as a group because there are a lot of back-end challenges when running a practice. So more heads is better than one. Increased number of physicians in a group spreads the burden of covering clinical care across a greater number of people, allowing more flexibility in schedules. So what's good about a group practice is that in case you do have an emergency, a personal one or a professional one, you can always ask one of your colleagues to help you, okay, cover your shift or your time or even your patient. So you can refer to each other. Okay, so it creates more of a work-life balance. Okay, so creating shorter work hours is one. And of course, access to more working capital. So when starting any practice, you would need capital, and it's really hard if you're a startup. So the more of you, the more capital you can work with. And of course, with this, it will lead to lesser stress. Okay, so we all want to manage our stress well, to have lesser sources of stress as well, even as doctors. However, aside, of course, with benefits, you have drawbacks. So one of the drawbacks of group practice is less individual freedom, okay? Limits the ability to rapidly grow your income. So because the income has to be divided, and the need for consensus on business decisions. So it's not just one person's decision, it has to be everybody's decision. And so autonomy and decision-making ability will decrease as the size of any group will increase. So the more people, unfortunately, there will be higher risk for conflict, especially in practices, in your group practice issues. Larger practices may also tend to become more bureaucratic and policy-driven, so this can be a disadvantage. So you should know how many group or members you should have. It doesn't necessarily the more the better, but just an adequate amount of people who you think is important in managing the patients or the number of flow of patients that you see each day. Okay, so those are the benefits of a group practice for patients and doctors. And of course, at the end of the day, the focus is patient care for the best of the patient's management and treatment. Okay, so that's all what we want as doctors. So these are my references, and if you do have questions, I'll take them during the Q&A. And again, thank you so much for having me as one of your speakers. A healthy day to everybody.
lifestyle medicine for COVID-19 and NCD care, a wake-up call.
Evidence-based, clinically researched, lifestyle medicine aligned natural supplements effective for metabolic syndromes such as diabetes, blood cholesterol, for cancer, and other immune deficiencies. That's Simply Nature products for you. Thank you, Dr. Johan, for the strong endorsement, and also a big thank you to the many doctors that have worked with us over the years to successfully support and treat patients. Nutritional supplementation for therapeutic effect. Every successful treatment protocol needs a strong foundational anchor. For lifestyle medicine, Simply Nature PPAR series provides that foundation. The key advantage and effect is how our Simply Nature tablets and extracts are able to unlock and magnify the benefits of lifestyle medicine. The key word here is epigenetics, gene activation. The unique phytonutrients and PPAR's agonist combination activates genes, initiating pathways that modulate the immune system, inflammation, metabolic processes, and cell delineation. Switching on these pathways kickstarts your patient's body to respond to the lifestyle changes and protocols you will be prescribing them. Simply Nature products are plant-based whole superfoods. Our tablets are lightly processed, and our unique microalgae is simply just cleaned and then pressed into convenient chewable microtablets. Our extracts are concentrated without using chemical extractions from our microalgae. They are natural, safe, and do not have any known contraindications with medication. Let's take a look at the amazing nutritional profile of our Simply Nature PPAR micro tablets. Just 4 grams of our micro tablets is equivalent to 140 grams of mixed vegetables, or 1 cup of mixed vegetables. 4 grams of our microalgae has more protein than 140 grams cup of mixed vegetables. In fact, our microalgae is 60% plant protein with the complete amino acid profile, which is not found in vegetables. It contains the highest CGF found in any microalgae. It's rich in phytonutrients, rich in minerals, rich in vitamins. Just take a look at the full profile that's being shown on your screen right now. And again, our extracts are natural concentrates of our microalgae. They are powerful gene activators and rich in cellular nutrition such as phytonutrients, PPAR agonists, and CGF. Now we've covered how Simply Nature products is effective as a foundational prescription for lifestyle medicine protocols. It has an incredible nutritional profile, but more importantly, it is a gene activator that will help you get consistent and effective results for your patients.
Now, let us gather once again. This coming September 30, 2021, we are going to have a doctor's forum discussing on how our PPAR's protocol works to your cancer patient at the same time to your COVID patient. And this is 100% free for all PCLM participants and members. So, sign up now